Welcome, everyone. My name is Joanne Geer, and I am Executive Director for the Westchester Biotech Project. We are based in Westchester County, New York, and involved with a lot of really interesting programs you'll hear about very briefly in a moment. We're going to hear from Philippe Salphati, who is the head of the Westchester Biotech Project Europe. It's kind of a sister city organization to us. From Jason Helgerson, who's going to give the primary presentation today on value-based healthcare. And we're also going to hear, when we get into our discussion session, from Vladimir Makarov, who's a consultant with the Pistoia Alliance. We are recording the session. We record the entire session, but we only post the presentation part on our YouTube channel. So you can feel free to speak. If you say something quotable and we'd like to quote you, we will contact you before we do anything about it. Please feel free to put questions in the chat box. We'll actually go through the whole first section of presentations before we address your questions. And when we get into the second, so the whole first section will take around 30 minutes. And then we will have a good full hour for discussion. And we'll actually invite everyone on the call one by one to introduce yourself, ask questions, comment on the topic, and so on. Let's see. I'm going to introduce Michael Welling, who is the co-founder with myself of the Westchester Biotech Project. Michael, would you like to say a few words?
I will. Thank you very much, Joanne, and good morning or good afternoon to everyone who's joining us today. And I am quite excited about, can you hear me?
Okay, I'll do it.
Joanne, can you hear me?
We love this quote. We launched in 2017 and have since run a number of roundtables, symposia, charrettes, many interviews and so on, and really listening to what people are doing in our region. And anything you can imagine, from very early basic research through discovery, translation, clinical research, all the way through to patients, is going on in Westchester County, which is just north of New York City. So we're right in the middle of the megalopolis. We have found amazing work going on, and everybody here is collaborating nationally and internationally. So we're particularly excited about the launch of the Westchester Biotech Project Europe. We have developed a number of initiatives. This Biotech Blueprint 2030 just got started this spring and is really about developing a framework and identifying opportunities and gaps going forward. One of the really exciting things that's happening currently that you may have heard about is that Biomed Realty, which owns about half of Kendall Park in Cambridge, Massachusetts, and also owns a lot of laboratories in Cambridge, UK, have become partners with us, and they are developing the I'm sorry, I see a chat that maybe there's a muting issue. I hope people can hear me. I'm always so articulate when the phone hangs up. Chris, are you hearing me? Let's just check that. Anyway, they are building a new facility for expansion space for growing companies in Westchester. So these are going to be post-seed companies coming out of incubators in the New York City area. Okay, there we go. Our activities basically fit into two large buckets. We have programs that we call Lab to Market that really focus on bringing together people at all these different stages of research, all the way through to commercialization and growth. And then another group, and of course there's lots of interaction, looking at building the biotech cluster, and there's a workforce development aspect that crosses both of those. We're always happy to partner with new folks, and we are very appreciative of the various different institutions, companies, nonprofits, and organizations that are collaborating with us. It's really been a quite gratifying, the number of people and organizations that have gotten involved with us. That's Michael and myself in that picture there, and we really feel like with the input of everybody there, that everybody involved on the call today, that we're going to be able to make some great progress. I'm going to hand it over to Philippe now, and let's see. Do you have are you there, Philippe? Are you ready to speak up?
Yes.
And
yes.
It is helpful if folks can mute yourself if you're not speaking. Philippe, there you go.
Yes, thank you very much, Joanne. My name is Philippe Salphati. I am the president and CEO of Fire Consulting, and I am also the founder in collaboration with you. Are you hearing me? Can you hear me? Hello? Hello?
Yes,
Hello?
we hear you fine.
We hear you.
Okay, very good.
You sound good.
Okay, very good. Thank you. So along with Westchester Biotech, which I call US, we are collaborating across the ocean to build up the European hub for Westchester Biotech. And we are focusing on 3 areas. The first one is stimulating medical, scientific, and technological discussion between researchers within Europe and between Europe and USA. And the second is we want to be a one-stop shop for every startup involved in the health fields, whatever it is, legal, go-to-market strategy, fundraising, regulatory, and so on. And the third is something which is specific for us to Europe is we have developed a public-private partnership to accelerate funding for early stage startups. As we know, the startups are crossing what is called the death valley, and they have whoever they are, very good, disruptive or not, they have a lot of difficulty to raise a significant amount of funds that are needed to push their idea. So that's in a nutshell who I am, what we do, and that's all for me.
Thank you, Philippe. This is Joanne. I can hear you now. I've called in by phone. We'll next introduce Jason Helgerson, our main speaker. And Jason, I'm going to make you the presenter.
Well, thank you very much. It certainly is a pleasure. So I'm Jason Helgerson. I'm the Chief Solutions Officer and founder of Helgerson Solutions Group. A firm, it's a global health consultancy focused on the move to value in healthcare. And founded that a little over a year ago here in New York. But prior to that, I was the New York State Medicaid director, ran the Medicaid program in New York State for approximately 7.5 years. New York Medicaid is a $70 billion enterprise, one of the largest government healthcare programs in the world, and was very focused on moving that very large government payer to out of fee-for-service into a value-based world. In fact, the New York State Department of Health just announced today that almost 2/3 of all reimbursements made by that program are value-based now in New York State. So, work very, very hard, and am very committed to the move to value in healthcare. So I'm pleased today to have the opportunity to talk about the sort of international perspectives in value-based healthcare, and talk about particularly what it means for what I refer to as sort of the supply chain of healthcare, organizations that are providing vital services, devices, treatments within the healthcare system, and sometimes are really sort of left behind or not sort of front and center in a lot of the discussions in the value proposition, the value-based discussion. Oftentimes we think about value-based care or value-based payment, it's a focused conversation on hospitals and doctors and such. But really it is a phenomenon, a movement that really affects the entire supply chain, the entire industry. So today, in addition to helping, I hope define what we mean by value-based healthcare, but also to give some tangible examples of how supply chain organizations are responding to this new incentives and the new world created by those incentives. So with that, as I say, my overview is, I think it might be most helpful for our conversation today to sort of define value-based healthcare. It's used almost in a ubiquitous form globally, but rarely do we take the time to actually define it. I will give you my definition, but obviously everyone is free to take issue with it or think about it in their own ways. I will then talk specifically about what all this means for medtech and pharmaceutical manufacturers. It's a very exciting time, and as mentioned with the Westchester project, there's such a tremendous amount of energy and research and funding going into developing new treatments, new procedures, and so what does that all mean? What does the mood of value mean for that important and vibrant aspect of the healthcare system? And then I'll just have some final closing thoughts on the journey ahead. So let's start with a definition. So when I think about value-based healthcare, I think first and foremost of a model of healthcare in which providers are paid based on health outcomes. Historically, in most nations around the world, particularly here in the United States, providers were paid based on units of service provided, and whether that service was the right service, an effective service, whether it was a good outcome, bad outcome, there was little, if any, dollars or pounds or euros or whichever currency you want to choose that was actually linked to performance. And to a great extent, my view is we have the healthcare system today around the world that we paid for, a system that encouraged silos, discouraged collaboration, and really overinvested in certain areas, particularly pretty sophisticated, very expensive acute care services, heavy infrastructure, particularly on the inpatient side, and underinvested in things that actually prevent illness and actually treat it more cost effectively. And so what we're seeing now is a desire, particularly among payers, but also among providers, to move away from this fee-for-service system and mentality and move to one where we allow organizations to work together and focus really on value. And typically when we talk about value, we talk about looking at both measurably improving health outcomes for individuals, populations, panels, but also taking into account the cost of providing those services. So in reality, when we talk about value-based healthcare, we're really talking about increased efficiency. We're getting more for the money that is spent to achieve those particular outcomes or to provide those specific services. And when I think about, I mean, to sort of boil it down, value-based healthcare really is about improving overall efficiency in the system, which to a great extent is a pressing issue. Whether you're in the United States where 19% of GDP is spent on healthcare, or you're in a country, say like the United Kingdom, where it's less than 9%, but you've got a system that is very challenged, very stretched, where a bad flu season can really be crippling for the healthcare system. I think there's an imperative to become more efficient, almost any nation you'd find. But I think it's also important to think that there isn't a single definition of value. And in fact, value can and should appropriately be defined differently in different situations. And I'll talk a little bit in a minute about how you can sort of think about what value means to different sort of actors within the system. But I do think that it's important to remember that moving away from and moving to a new payment system is a necessary but not sufficient condition for value-based care. The change in payment, the change in financial incentives in the system creates an environment for changes in how care is actually provided to patients and communities, but it doesn't necessarily automatically drive that change. I see oftentimes in our practice that there's a lot of focus on getting organizations into contracts, value-based contracts, but underappreciation of the fact that when you do go into these new arrangements, you actually have to change what you do every day. That means you have to engage the front lines of the healthcare system to change care at the point it's provided. And only when that happens do we really have a value-based healthcare system. So I found this slide from an article, New England Journal of Medicine Catalyst, it was actually put together by the Massachusetts Medical Society, that looked at value-based healthcare and its benefits to different types of organizations. Here you can see patients obviously looking for lower costs and better outcomes, providers. Obviously, we have significant burnout issues across multiple nations, serious workforce challenges, Can we use this as a way to improve satisfaction, increase efficiency, happier patients, happier providers? Payers obviously want cost control, they want reduced risks. Suppliers, they want alignment with prices and with outcomes. They want to be able to understand the rules of the game and be able to develop new products that are consistent with those rules. And then lastly, society. Obviously, society, health and healthcare are some of the most important things that society offers its citizens. Ultimately, society wants an affordable system, reducing healthcare costs, and better overall health. So value-based payment and value-based healthcare does ultimately involve providers taking risk. And this is often the point at which people start getting nervous. Many organizations across healthcare are taking some kind of risk, whether they like it or not. Whenever you start talking about increased risk, particularly financial risk, especially organizations that have very tight margins, there's a fear factor associated with that. But what I think is true is that government, whether that's the Centers for Medicaid and Medicare Services here in the US, or NHS England, or other now government payers or states here across the US, and then you're also seeing this amongst commercial insurance companies here in the US, increasing desire among payers to have providers taking on risk, both for clinical and financial. Now, those payment arrangements, they can take multiple forms. There could be episodic payments, total cost of care, subcapitation. But there also are opportunities in which the risk that's taken is what we refer to here in New York as upside only, meaning if you're successful at managing total cost of care across an episode or a year, you are rewarded financially for it. Now, if you have poor outcomes or you're unsuccessful, there isn't a downside. And that's often a good starting point. And I argue any provider of any type can go an upside only. But what we're seeing, certainly here in the US, is a push to go into upside and downside arrangements where there is a financial consequence for failure. And I think that there's going to be a driving trend across the US, and I think more interest around the world about getting providers into these upside and downside arrangements. But I do think it's important to point out that there are multiple options for providers and payers when it comes to these kind of risk arrangements. So what does the move to value and value-based care mean for the supply chain within the industry? And I often hear from audiences that I talk to about this topic as they say, well, haven't we been in the value business all along? In fact, particularly in American healthcare, where there is remains a very strong belief that it is a free market system where organizations are competing, and many will say that probably the purest place for that market philosophy is in things like diagnostics, medical technology, where you have multiple manufacturers providing solutions with a series of clients, oftentimes hospitals, reference labs, others, who are in essence choosing and negotiating between the various options that are available to them. And that is potentially in some cases, that is a robust market. But ultimately in that case, you've got hospitals or other actors who are being pushed by their payers into these value-based arrangements. And when that happens, they're going to be looking at any and all of their partners, their vendors, to be facing the same financial incentives they are. And I think ultimately that means that even if you aren't in a direct relationship with a payer, you are going to feel the consequences of the move to value. So I give a couple of examples here from Medtronic. Medtronic is not a client of ours at Helgerson Solutions Group, but I appreciate them because they are willing to actually post case studies, and they're also very committed to the move to value in healthcare. And so just to give a couple real quickly here of what Medtronic sees really as a global phenomenon. I think that is one of the interesting things about this aspect of the industry is that these are companies that are selling solutions all around the world. Clearly, the panel here today is representative of that, and they clearly, as in Medtronic, sees this as a global effort, and they're approaching it as such. And they also see these risk-based contracts and data transparency as the fundamental or foundational requirements of the journey to value. But I think it's key to think about is that particularly for supply chain manufacturers, rarely are you the sole solution to improved outcomes. Often you are an input to within a broader process, and that really requires partnerships. And I think that's really where Medtronic is focused, and appropriately so, is forming partnerships with different types of organizations and seeing itself as a value-added partner in each of those arrangements. So here are my examples. First and foremost is Imperial College in London, where Medtronic came in and served as an independent vendor solution and basically managing the cath lab, allowed the hospital staff to go back to doing their basic business. They did this in a vendor neutral type of fashion, but also very focused on outcomes, and their reimbursement for the provision of these services within Imperial were directly linked to improved performance of the lab and improved performance of the hospital and all the providers within it, generated efficiency savings, increased morale within the hospital. But I do think it's an interesting example of the kind of partnerships that I will see more and more of. Not that there aren't plenty of examples of labs being outsourced to vendors, but I think what's interesting here is the example of how they get paid, and that their reimbursement was directly tied to efficiency improvements within the lab and better outcomes for patients. Next is Einstein Hospital in Brazil, and in this case, an even more comprehensive model where you really had a hospital and a manufacturer working together to find ways that they can improve the well-being, particularly focused of patients, particularly on those with chronic illnesses who did not have the ability to cover out-of-pocket expenses. Very poor population that they focused on there in Brazil. And they looked at a variety of different outcomes, including one that's underutilized here in the US, and that is patient-reported outcomes. Very powerful measure. It's used really here mostly in clinical trials, but used more extensively in Europe and elsewhere. But really to try to figure out whether or not the patients are really feeling like their experience is improved, whether they felt like they were respected, treated well, whether the care they got was appropriate. And I think the key thing here is that they worked very much collaboratively with the doctor-led multidisciplinary groups, focused on very specific types of patients. Their reimbursement, once again, tied to overall outcomes improvement, not just in patient outcomes, but also some true efficiency measures like avoiding waste, increasing quality and safety. But definitely working together, both organizations moving away from a volume-based culture to a value-based culture. And this is a good example, I think, of a manufacturer really being an instigator of the move to value within a healthcare provider in a country with a population with significant challenges. And then lastly, here in the US, Lee Valley Health Network in Pennsylvania, good partnership here where together they're sharing accountable for patient outcomes, specifically with products for which the supplier is and bringing their technology and very specific services to this health system, and together they are accountable for better outcomes and reduced cost. An interesting opportunity for medical technology organizations, instead of just selling your product for a price, for a unit price, entering into a joint agreement with payers, looking for ways that you together can commit to better and lower costs. It's a way to increase market share. It's a way to get market access and market penetration. And in this case, they have a 5-year commitment to lower healthcare costs, and this is total cost of care across the patients that they're serving of $100 million. And I think this is the kind of thing that I would like to see more of, is these kind of partnerships. I think it'll change the relationship. And I do fear if we don't get into some of these, that what'll happen is more and more of the healthcare system is moved into these arrangements. They will see those supply chain vendors as cost centers, and they will want to squeeze those cost centers as opposed to wanting to grow them, which will really stifle innovation in ways that I think will have unintended consequences. So the key lesson learned, at least to date, and obviously this worked for Medtronic, obviously one of the world's largest medical technology manufacturers, is collaboration requires a level of nimbleness and flexibility to explore opportunities in front of us and take risks together that drive progress further and faster. Just a couple of final lessons here in terms of med tech and pharma. VBP is hard and it's complex, and it's easy to sometimes say, just forget it. But But I think that the lesson here, in my perspective as a longtime government payer, very large government payer, is that we're not going back to fee for service. The demands on all aspects of the healthcare system to move to value is just going to continue. And I think you're better getting ahead of it than waiting around for someone to sort of force you into it late in the game. Clinical partnerships are key, as the examples that I gave from Medtronic. And also value-based contracts can also be used as a way to build evidence. I think what we're going to see, and we're already seeing it from supply chain manufacturers, what they're seeing in the market is higher and higher expectations about around the quality of the evidence that they're providing. People really care about comparative effectiveness, especially if you're coming out with a new treatment that's flat out more expensive. You really have to be able to demonstrate with data how much more effective your treatment is. And expectations in the marketplace are rising. One way to generate that evidence is when you are is in these value-based arrangements, and then you can use that evidence to increase market access elsewhere. And then obviously, I mean, my always suggestion is focus your VBP efforts on new products, especially ones that are relatively expensive. Those are the products where you're going to find the greatest resistance. A hospital system that is in a total cost of care arrangement, anything that drives up their costs, even if there's incremental improvements in outcomes, you're going to get a lot of questions from that hospital system, particularly here in the US. And if you are offering something that is a new treatment, even if it's incrementally better, but if it's considerably more expensive, you're going to want to explore value-based arrangements. We're already seeing this, particularly with some of the more complex pharmaceutical treatments, the CAR-Ts, these new very expensive drugs where there's a clear pay for results type approach that's being deployed. I think we should expect to see more of that. So my closing thoughts are, I think it's a very exciting time in healthcare. I think the world is shrinking. I think the move to value, certainly my firm, we work in a number of countries across Europe, in Africa and Asia. We see a growing interest in this. I think that that you're going to see, companies will see increased demands and expectations around this. I think it's a great opportunity to differentiate yourself in the market. I certainly see a mix across the supply chain, some very interested and excited, others burying their head in the sand. So I think it's a great opportunity if you decide to take it. So that's it, and thank you very much, and I look forward to our further discussion.